and welcome to all of our viewers from around the world. I'm Kristen Schwarz, licensed midwife and MC here at Gold, and I'm very excited. I have a very special guest here with me. It's Effath Yasmin. Hi, Yasmin. It's so good to see you back here at Gold.
Hi, Christine. Thank you so much for having me today.
You are one of our speakers for our add-on package for the Gold Midwifery online conference that we're kicking off here in just a few short days on February 6th. And I want to talk to you about the topic in just a moment. But first of all, Yasmin, where in the world are you located? Where are you coming to us from?
Well, I'm from Mumbai, India.
Hmm.
Yeah, and it's a beautiful weather right now, but it's mostly hot and it's either hot, warm, or hotter. That's how our weather is. Yes. So we are at our best winter, which is just pleasant atmosphere at this point. And
Mhm.
sometimes for us, it gets a bit chilly, but nowhere close to what you would experience in your part of the world. Yeah.
Yeah, yes.
Yeah.
Oh, thank you so much for sharing that. So, yeah, you have quite an impressive background. You are a cranial sacral therapist, you're an IBCLC, a filmmaker, and so much more. And right now, you're also pursuing your PhD. So, tell us a little bit about, first of all, how did that all, this whole beautiful package that you have in your education, how did that all happen? And how did you create this kind of holistic path for yourself?
Right. Yeah. I mean, it's very interesting for me in my own life because I think, recently I was just thinking about it and I actually shared it with you as well when we had this personal interaction. It was beautiful
Mhm.
that I had this moment where I could actually share that the light enters through the wound,
Mhm.
usually. And this is what it's been true in my life as well. That when there are difficult times, it somehow opens a doorway for us to learn, to be able to re-equip ourselves and to see the world in a new light.
Mhm.
And that's how my life has been. That, I started off doing completely different things in my education back then during college years, and then doing my post graduation in political science and international relationship, which was very different from what I'm doing today. So, but motherhood actually changed the course of my life. So the experiences I had took me inward, looking at how my body was experiencing what was happening, Christine.
Mhm.
So that made me start to think and be more reflective on how do we think about it from the mind perspective versus what the body is doing, you know?
Yeah.
And that took me in, and I started connecting with people who resonated with my inner world, if I have to call that way. And new people started to come in my life, and new knowledge started to come in my life. Started to understand about babies and how they respond and what happens during pregnancy, which was so I was so naive about it. Like during my pregnancy, I was very naive about it. It was just a normal experience for me. But as things turned, curveballed, then things took me in different directions. And that's how I started to learn and, be more educated and knowledgeable about it. And took in new courses, which was completely different from what I had done earlier. And the whole new world just opened up for me in terms of lactation. And then while I was doing the lactation work, I realized that there is so much there's so much of limitations in what we can offer in terms of counseling and support. And it needed to be supported with more healing approaches that were trauma informed. We were talking about what did we experience during our pregnancy and birth and what's happening in breastfeeding, and how do we respond to trauma
Mm.
in
Yeah.
life. And that needed for me to be equipped with what do I do if I see trauma and feel trauma
Yeah.
in the babies that I was supporting and the
Yeah.
mothers that I was supporting. So I had to equip myself with craniosacral work, and that really opened up a completely different holistic approach of life. And not just the perspective from a professional point of view, but it's kind of just absorbed into my life itself, Christine.
Mhm.
Yes.
Yeah.
Yeah.
I can fully see that because I mean it's beautiful how you describe your journey, the light shine through the wound, what you've experienced yourself, and what you've learned, taking that, educating yourself, and making things better for other families. So going through, what you experience, and kind of hopefully change their outcome and their experience with what you have to offer, and how seeing everything through your trauma-informed lens. I really think that makes a big, big difference to the community there. You mentioned we talked about this a little bit before we got here together in the recording, about your film, about the film that you have created, Untying Breastfeeding. Talk about this a little bit. And it's very special to you. It's like you poured your heart and soul into this. It's a work of love. So talk about it.
Yeah, it is a labor of love. And I would think that it was just not me, but the stories of the women that I was interacting with had to be told, Christine. And
Mm-hmm.
that journey started many, many years ago, almost a decade ago, when I felt strongly that these stories have to be told, because I didn't see any of the documentaries or films that really revolved around speaking about women's experiences and what they were going through, right? Especially at the stage when they were breastfeeding the baby. I had watched a few movies and films or documentaries that covered some of those experiences during birth and pregnancy, but nothing really after that. And I felt that was the longest period of a woman's life, because pregnancy would last only about 9 months approximately. But we are looking at breastfeeding journey, which lasts somewhere between months to years. And if they're having more babies,
Well,
then
babies.
you can see that it can be a continuous process. So it's such an integral part of women's life. And that had to be told. And I felt I was not equipped, because I was not a filmmaker. I had no idea how to go about that, but I knew that it had to be done. And I guess that is the only, I realized that the intent is what really matters. And
Yeah.
then the universe just chooses you to be the messenger, and I just had to go through that process. And I learned a lot, because I also needed to learn how to frame the story, how to put stories in there, and many other things that just came about the whole process of 7 years through which the film was made. Yeah. So finally, when the film came out, it was received with so much love. And the first time it screened, the premiere was in Gold Coast. I remember still. It was in 2018. It was in the conference of the tongue tie and Gold Coast in Australia. It was received with so much love, and I realized that this story needed to be told, because there were people whose hearts were open to receive it as well. So,
Beautiful.
I was just humbled to be chosen to be a part of the journey. Yes.
Beautiful. Yes. And this film is available to our viewers as well, participants in the add-on package that are going to be watching your presentation will have access to that film. Is that correct?
That's right, Christine. So it will
Beautiful.
be screened by Gold. So I'm grateful for that. Please go watch that, because there is something that will touch everyone's
Yes.
life. I hope that it touches
Yeah.
everyone's. Yes.
It does. I can only agree to that with that, because it does touch lives. Watching this is definitely a very touching experience for anybody interested in that topic there. Your topic for the add-on package is titled Trauma-Informed Care. And this is so this is you're the expert in trauma-informed care in clinical infant oral assessment, understanding body autonomy. And I find that very interesting, because in recent years, we have really we are shining the light really onto trauma-informed care. I'm glad that this is happening, for women, for also for children here. But this, we have come a long way when we did the newborn exam, where we kind of slapped the baby on the butt or hung, you know what I mean? Really kind of almost rough
Yes.
to that point.
Right.
Where now we're looking at this going, wait a minute, do we really have to take the baby from the parents in this separate area? How can we make this
Yes.
so that the connection is not lost, that beautiful bond between the newborn and the mom and the parents and the family unit is sacred. And how can we keep it that way. Even if we need to do our assessments, which are important, we need to make sure everything is going, that is, the infant is doing well, and if there needs to be anything done, that we can jump into action. But how can we do this in a way that is trauma informed and caring? And I want you to talk about this a little bit now, and also about the part of the understanding body autonomy part in your presentation as well.
Well, I think that was that was the journey that I was just speaking about to you. That during the pregnancy, the things that were happening to my body and how I was experiencing really opened that whole consciousness, just to be aware of what the body was going through. You
Mm-hmm.
know, because body doesn't have a language with words.
No,
It
yeah.
really doesn't speak with words. What it does speak about is with sensations. We are constant, the language of the body is sensations, Christine. And
Mm-hmm.
it's constantly going to keep recording that in our bodies, right?
Yeah.
So when that started to come into my experience, I started to notice that we are often not being sensitive or subtle about how we approach another person.
Mm-hmm.
You know, the
Yeah.
space between us and others, and how we interact with another person or even that little baby, we are not conscious to its context and its environment.
Mm-hmm.
And we have to be sensitive to know that this is an environment that is the mother's body. The baby's environment, natural environment, and habitat is the mother's body. So if we want to interact with the baby, we need to keep its context alive. So we bring in the mother and continue to keep her in the context. And we are interacting only with her in the context at all times.
Mm-hmm.
So if the baby is feeling safe and supported, because safety is a very important part of how we feel about ourselves.
Yeah.
The way we respond to life and the way we approach life is usually from the lens of being safe first, because safety comes first to all of us,
Right.
right? And that I will be speaking about in the presentation as well, because that's how our brain is wired
Yeah.
to perceive things in life, right? So
Absolutely.
if we are able to keep the precinct of that autonomy of being able to protect ourselves and feel safe and be able to interact with our free will, then you have a lot more cooperation, Christine. Because
Mm-hmm.
I noticed that, you know, not only the fact that we're doing assessments that sometimes is required, but also the fact that we are sometimes having to do surgical approaches or procedures for babies like tongue ties. If
Yeah.
babies have tongue ties and other kind of procedures, we're having to actually go into their oral cavity and work there and be, how do we engage the little baby with consent and also allow the best outcome to happen?
Yeah.
So
Yeah.
that's the whole paradigm that we are kind of exploring through this process, right?
That's absolutely fascinating. It's so beautiful how you describe it. Number one, that how the body keeps its score for everything that's happening to it. Safety is paramount, because we're hardwired that way. It's our survival, right? And that's the first thing that we as a species, if we don't feel safe, this is not good, because it's like our body is thinking, oh, we are at risk. We're not surviving. So having the parent there, having the mother there, making sure that the baby feels safe for anything that
Mm.
needs to be done is so important, because I can only imagine, Yasmin, how that will affect not only the immediate outcome, but also later
Hmm.
in life, that child,
Right.
right? if
Yeah.
if this
Yeah.
bond is broken, if a little newborn feels unsafe and scared and traumatized, that must be somewhere staying in the body, or and keeping score of it, and have an
That's
effect.
the fulcrum, Christine, because the mother, other parent or caregiver, it could be, the entire family unit. They are the fulcrum through which the child as is growing and the baby as is growing into being a child and being an adult eventually is going to connect with the rest of the world.
Mm-hmm.
So if my environment is not giving me that sense of safety and belonging and
Yeah.
acceptance, then how do I connect with everyone else? Because usually we are responding with either feeling attacked or We
Right.
feel like we need to constantly safeguard our safety and how our interactions are. So they're not really going to take us into a space of exploration until we are taking care of that boundary first. So we're losing a lot in life if we are constantly reframing ourselves. You know, if
Yeah.
I have to keep reframing myself to kind of feel safe, how much more is lost in that interaction and relationship with people outside in the world?
Yeah, that's interesting. Yeah, that's a totally new way of looking at things, because again, we're constantly reframing ourselves. What else is lost there? So it makes so much sense that we really looking into how do we care, how do we care for our little ones, how do we, even in the evaluation, how do we treat them, how we can be conscious of what is the best for them and the unit, the family unit, without interfering too much. Yes, we have to do our work, but how can we do this so they still feel safe in the context and protected? Yasmin, this is so fascinating. I wish I could talk to you for hours, but I know we have to go. We have to conclude this recording here. Any last words before I let you go? First of all, you also offer some trainings yourself through your organization. Let our viewers know where they can, how they can reach you. And any last words for our viewers that you have that you might want to share?
No, I'm just excited to keep that interaction and conversation going about how can we be subtle about our being ourselves, and how can we acknowledge the people around us, and what is it that they are bringing to us, and what's the interaction that we have that allows us to grow into life, because we are meant to be in this community to help each other grow. But if we are busy trying to kind of renegotiate our boundaries at all times, then how much more are we losing in our enrichment of life? That's the only thing that's the precinct of the work that I'm hoping to kind of bring in through my clinical work. And hopefully that will also kind of open up a little bit in our lecture, in the upcoming lecture as well. But I would urge us to go and watch the film, because that really sets the whole fundamental precinct from where I'm coming in terms of acknowledgement. I think acknowledgement is the key to healing. Without acknowledgement, there's no opening of the door for any of the aspects of our lives to be processed at all, you know. So, and there's also the website that you can go look for, which is nourishandnurture.in. You will find some of the information there, the different trainings that I offer, and also the Tongue Foundation. If you look for the NGO that we are working with, we give fellowship and certificate programs to understand more about trauma-informed approach to frenotomy, tongue ties, and babies who are having gone through an experience of birth trauma.
Well, Yasmin, thank you so very much for talking to me here today. It's been a pleasure speaking with you and learning from you here.
It's been a pleasure for me too, Christine. Thank you.
And for our viewers, if you are curious about this presentation titled Trauma-Informed Care in Clinical Oral Assessment, Understanding Body Autonomy, and all the other presentations in the lecture pack that is titled Clinical Tools for the Changing Landscape of Newborn Care, which is at the moment an add-on package to our midwifery conference of 2023, we invite you to go to goldlearning.com and goldsmidwifery.com to find out more. And we hope to see you at the conference, and enjoy the package that we have put together here at Gold. Thank you all for watching, and have a lovely rest of your day wherever you are in the world. Bye-bye, everyone.